Hello and welcome to Health Talks, a doctor-led podcast brought to you by HDFC Ergo General Insurance Company. If you see around us today, we are coming across situations which were never heard of. We are experiencing things which in our earlier generation people were experiencing at the age of 60. At 30, we are reading people going to the gym and facing cardiac arrest, facing heart failure and so on and so forth. Today we will be focusing about heart and the ailments and the prevention that we need to take so that we remain healthy, our heart remains healthy and we live a long life. To help us answer our questions, guide in our this program today, we have invited a very senior cardiologist who is also a director at Fortis Mumbai, Dr. Atul Limaye, and he will be guiding us in terms of what are the things one should do to prevent any conditions happening. If at all somebody is coming across these conditions, what are the treatments, what are the things he should do and not do. And without taking much time, I will want to welcome Dr. Atul Limaye. Warm welcome to you, Dr. Atul. Thank you for sparing your time and coming for this program.
Thank you very much for having me. I'll try my best to see what I can do to make this short and simple and easily understandable to your entire audience.
Thank you. So the very first question I would want to ask you, because these days we come across celebrities going to gym, somebody trying to take protein at the age of 35, 40, people having cardiac arrest. What has happened? What has gone wrong with our hearts today?
So that's a very good question, and it is absolutely true that we are seeing a rise in the incidence of heart disease in younger and younger patients. I mean, a 25-year-old having a sudden heart attack used to be unheard of even 15, 20 years ago. I think the reason for that sort of thing happening is multifactorial. There isn't one reason for that. And some of the common factors that have been identified is this low level of inflammation in our system, which is primarily brought by lifestyle. So our lifestyles now are much different from what they used to be 30 years ago. We are living a much more fast-paced life. We are living a life where sleep is less, where restfulness and mindfulness is less, stress is more. And when this accumulates over a period of many, many years, we are sort of living in a chronic stress situation. And you compound that with bad lifestyle, bad dietary habits, sedentary lifestyle, lack of exercise, and if you throw in some risk factors such as smoking, tobacco use, undiagnosed blood pressure, or undiagnosed diabetes, then you have a cocktail of several things going on in your system that promote heart disease and promote this aspect of early heart attacks and early heart problems.
Are there some early warning signals which a person should be mindful of?
There are some very classic symptoms of heart disease that one should absolutely be mindful of. And those symptoms are chest pain, chest pressure, sometimes chest discomfort radiating to the jaws or both arms, back pain, unusual fatigue. So what I ask patients is, if you are used to walking, let's say 30 minutes every day, are you getting tired in the first 20 minutes now, which did not happen before? Another very important question I tend to ask people is what you are describing as acidity, is that a new symptom for you, or have you always had some level of acidity? And when patients tell me, no, this is completely new, it may not be acidity. It may be a reflection of a heart symptom that is coming in as acid reflux disease.
Oh, so I think acidity, which we take it as a routine thing and we take antacids and we believe we are fine, I think that is something which one should not be ignoring at all.
That's right.
Is there a particular age at which an acidity could be a normal acidity, or are you saying at the age of 18 also if somebody is having acidity he might have to be worried about his heart?
No, I think that it is very appropriate for a person who is having what he describes as acid reflux or acidity to try to see if taking antacids takes care of this discomfort. And if it does, and if the symptoms go away, it may be just because he ate a bad pizza or a bad piece of chicken the night before.
Yeah.
But on the other hand, if the symptoms continue and several days pass by and he is still having these symptoms, and they are now happening with routine exertion or climbing stairs, then those are then leading you to red flags and early warning signs, which would definitely merit more attention.
It is said that you exercise it daily. I believe all doctors, including you, would be suggesting to your patients that go for exercise, go for a walk. Does it help? Number one. If you have to walk, how many minutes a day? Number two. If I have to go for a gym, what is the optimum time I should go for gymming? Is weights versus cardio versus abs? What is the right mix of that exercise?
That's an excellent question. I think in general, 30 to 40 minutes of brisk activity most days of the week, by which I mean at least 5 days in a week, is what is recommended. Now, that can be a mix of just brisk walking, or if you're interested in running or jogging, that is also okay. Team sports keeps somebody motivated. So if you have a partner with whom you can play a game like football or badminton or tennis, that is even better because, as I said, it keeps you motivated. What is additionally also helpful is some amount of strength training, which means light weights in the gym, or if you don't want to go to the gym, you can just do the good old-fashioned Surya Namaskar, which really exercises multiple aspects of your body and gives you natural strength training. If you can also incorporate some yoga practices and some meditation, now you have a full mix of aerobic activity, strength training, yoga, and some mindfulness in the form of meditation.
But does a person's weight also play a role in his heart condition?
See, that's a very important question, and I get asked that question a lot. And my answer to that is, generally speaking, as a broad rule, I'm not interested in how much you weigh. What I'm interested is in how fit you are. And I'll give you a classic example of that. Let's imagine a slightly overweight person who can easily climb 4 flights of stairs and can run 5 kilometers. And I'm sure you know plenty of people like that. And I'm sure you also know plenty of people who are thin as a rail, but cannot climb even 1 flight of stairs and cannot run 2 blocks outside on the road. So you tell me who is healthier, right? Obviously, the person who's slightly overweight is much more healthier because he is fitter. And therefore, being fitter is more important from a heart health standpoint than whether you are thin or obese.
Great. So, as a last question to you, what are those top 5 tips that you would want to tell us, if at all we have to be, and everybody, which applies to everyone, which we should be always concerned about, we should adhere to, so that our heart remains healthy and our loved ones who live in our heart, we are living with them for a longer time?
So I think the most important message that I want to give to you and your audience is that number one is lifestyle. Lifestyle modification is an essential part of, as the first step whenever we are interested or want to prevent heart disease. So by lifestyle, I mean a healthy diet, a healthy dose of exercise, which we spoke about. Make sure that you check your blood pressure. Have a health checkup done which identifies whether you have high blood pressure or not, whether you have high levels of cholesterol, whether you are diabetic or not. That takes care of the top 3 or 4 important things that you can do for your heart healthy lifestyle. The other thing is, a very, very big thing, is tobacco or smoking or vaping. So any form of tobacco is bad for you. I don't care if it's 3 cigarettes or if it is a 1 pack of cigarettes. Any amount of nicotine revs up your system, causes early inflammation and early buildup of cholesterol plaques. So smoking is a big no-no. As far as healthy diet is concerned, I am reminded of a very famous quote by Michael Pollan, who is an American journalist, and he has done a lot of research in the topic of diet. And what he says is 3 words: eat food, not too much, mostly plants. So let's unpack that. By what he means by eat food is what your grandmother or your great grandmother would identify as food. Number 2, don't eat too much. So eat in moderation. And number 3, mostly plants. So science today is moving more and more towards encouraging people to have a plant-based diet. And there is no doubt that a predominantly plant-based diet reduces inflammation, reduces carcinogens in your system, and overall promotes a heart-healthy lifestyle.
Sure. And since you talked about plant-based diet and so on and so forth, I would also want to slip in one more question. These days we hear about eat breakfast versus don't eat breakfast versus eat breakfast of fruits vis-a-vis finish your dinner by 7 o'clock and don't eat after 7 and so on and so forth. Is this helpful in our day-to-day life? Does it make sense, or these are all things which have been, folklores and stories that people have heard and have been passed on like Chinese whisper?
I think these are fads of the day that sort of come and go. But having said that, I do think that there is some merit in what we call, fasting for certain periods of the time. Because I think this idea of eating 5 or 6 times a day, I think does more harm to us than good. And the reason for that is, just imagine every time you eat, you are asking your pancreas to produce more insulin to take care of the food that you're eating. And therefore, what you have is a chronic rise in insulin levels in your system, which more and more scientists and medical doctors are identifying as not such a very good thing. So I think this concept of intermittent fasting, I think, has some benefits. There are some studies which are now outlining the benefits in terms of inflammation in our system. So I think there is some merit in that. But other than that, I think having a heavy breakfast and light lunch and light this and light that, I think those are fads that come and go.
And what about diets only of protein and diets only of carbs, or diet devoid of fats and carbs? Is it necessary?
No, I think I'm a very strong believer, as I said, in having a very balanced approach to life in general and specifically to diets in particular. So I think if we are having a plant-based diet, I think it takes care of a lot of these questions of what balance you need to maintain.
Thank you for answering all these questions, and to my lovely audience who are watching this show, thank you for patiently watching this, giving me all the insights for basis which we had these questions made. I would want to conclude this by mentioning that India has today become a hub of heart conditions. I think if I see WHO data, almost 20% of cardiovascular deaths worldwide happen in India. And we need to be very mindful about how we are maintaining ourselves, our lifestyle, the kind of stress, the kind of food and the kind of conditions that we see across. Also making sure that the diet that we are having on a day-to-day basis, it is a balanced diet, it's a mindful diet. But if still we have not been able to answer few questions, I request you to send us your messages directly at the rate HDFC Ergo GI, and we'll be more than happy to come back to you with the answers from the experts. Till then, take care, be informed, be aware, and make sure that people around you remain insured. Thank you.